Hi everybody and welcome to Positively Kimmie. I am Kimmie. If you are new here, welcome. This is a safe place. And if you're one of my return subscribers and my besties, hi guys, how are you? I hope you're all having an amazing day. Welcome to Ozempic Reboot, my Ozempic Friday videos. I'm starting Ozempic today again and we're going to see how it goes. I had to be off of it for those of you who don't know, because I ended up being in the hospital quite a few times with pancreatitis that they don't feel was from the Ozempic. I don't know what it was from. They're thinking of doing surgery and they're not thinking of doing surgery. So being that I've been good for 4 weeks now, I'm going to try and start it up again and see how it goes. So I am 193 as of this morning. Yesterday I was so much less, but I am constipated again as usual, and I don't have my constipation medicine to take at the moment. But I'm 193, and I'll come back on next Friday and tell you how I was, what symptoms, if any, I had, and whether or not I can stay on the Ozempic, and let you know my progress if there is any. Since I've been off the Ozempic, which has been for a couple months now, I've fluctuated between 190 and 195. So I haven't gained very much weight. I was 190 when I was doing it constantly. I think I got down to 189 was the lowest I've gotten down to, but I haven't been able to break that. But I'm proud of myself for being able to maintain my weight, being off the Ozempic for so long. So I'm really thankful for that. So when you get your Ozempic, it comes in a box like this. This is what it looks like. My name's here, so I'm not going to show that to you. It's Kimmie, by the way. Inside your box is your injectable pen, and this is going to have needles in it. There are 4 needles because one box lasts exactly 1 month. And you're going to need to get alcohol pads or alcohol swabs or just alcohol in a cotton ball. You can do it in your upper arm, your thigh, or your stomach. I like to do my stomach. In my head, if it's done in your stomach, then you're not going to eat as much. And that's not true. You're not going to eat as much regardless. It calms down the food chatter in your mind. There are a lot of side effects with monjaro, wegovy, Ozempic, and they're all semaglutide. They're all basically the same. You can have a lot of GI issues such as pancreatitis, such as gallbladder attacks. You can have vomiting, nausea, excessive poop, excessive constipation. I'm on other medicines that can cause those things too, so it's very difficult to see what it is that's causing them for me. But this is the first new thing I'm introducing into my diet, so I'll know if this is what's causing any of the issues, if I have any of those issues. And you can also have mental fogginess. You can have changes in your anxiety and depression. Just know that if you have any concerns that I can help you with, I'll be more than happy to answer them. But talk to your doctor with any major concerns that you have. I can tell you if something is normal, but I don't know what normal is for you. And even though I play a doctor on TV, I'm not one in real life, so I think I am. I know I am. That was my calling. I was meant to be a doctor. But I'll help you in any way I can. But seriously, if you have any major concerns, please speak to your doctor and I can help you with this. So this is my first time using Ozempic in about 2, maybe 3 months. And I'm going to start at my 2 milligram dose. I don't think I need to start from the 0.25 again, which is what you start on when you first start one of these drugs. By the way, just so you know, monjaro, wegovy, they have different dosings than the Ozempic. So if I'm saying 0.25 and yours is 1 point something, that your doctor knows what's best for you. So please listen to their advice on that. So what you're going to do, I'm going to do it in my stomach. I'm going to stand up and push you back a little bit. You're going to pull up your shirt and you're going to go to the fatty part of your stomach. I'm going to go right here. We're going to clean off the area with an alcohol swab. And I'm going to go right in here. Please excuse my fat. You're going to do a big area. because you don't know exactly where you're going to be putting the needle. Put that up there. You're going to take your pen and you're going to be taking one of your needles, and it's subcutaneous, so that means it doesn't go all the way in. It's not going to hurt. It's just a little prick, and that is it. You're going to take this part off. Now there is a needle in there. I don't know if you can see it, but there is a needle in there, so you're going to be careful. You're going to put that on. When you do that, you see a little window there. You're going to raise that to your dose. If you're in the beginning stages, 0.25 and 0.5, you'll have to look to see which one it is, because it won't stop automatically. We'll just go to the 0.5. You're going to take the one cap off. You're going to save it because you're going to need it. And you're going to take the other cap off, and be careful not to prick yourself. You're going to save both of those because you will need them to throw them out. And then we're going to just squeeze, put that in. It doesn't hurt. You'll hear clicking. When the clicking stops, you're going to let go of that. You're going to leave it in for 6 to 10 seconds. And then you're going to take it out. Put that down. You're going to get another clean alcohol pad and clean off the area you think that you got. So you're going to clean off more than you think. And that is it as far as giving yourself the injection. Now you're going to put the tops back on the needle because you'll have to dispose of them in the way your doctor told you to. Be very careful that you don't prick yourself with these. And you just untwist it. And these will go however your doctor told you to dispose of them. Put this back on. It does need to be refrigerated. So make sure it's refrigerated, and make sure you leave it out for 15 to 20 minutes prior to using the injection because it's more fluid that way. I'm going to move you up a little bit closer. Okay, and that is all you're going to do. You're not going to think about, oh my God, am I going to have side effects? You're not going to think about what's going to happen. You're just going to forget about it, and that's it. And you will notice that the food chatter in your head is going to stop. You're going to notice that you're not thinking about food as much. You're going to notice that you're not as hungry. I didn't notice that my first week. My first week, I still was like, I'm hungry, I'm bored, I need to eat something. But then after the first week, I started noticing a difference, and I've lost a total of 70 pounds so far. I was 154 when I started. I am now 193, so 71 pounds. And I'm so proud of myself for that. And I want to get down to my 130s. So that's where I want to be about. And we'll see if that's possible or not. I've made lifestyle changes too. I have been walking. I cut out soda. I've been eating more vegetables, especially that helps with the constipation. With the diarrhea and the extreme poop, you have to just, eat crackers for the nausea and stuff like that, and see if it's something that you can get around. If not, then you need to talk to your doctor, and maybe they can switch you to a different medication. But that's it. That's as far as it goes to take Ozempic. It's really easy. It's life-changing. It has changed my life. I was a big girl at 254 pounds because I'm only 5'1". I feel really good at the weight I'm at, but I still like to lose a lot more. And that's it. Hope this video helped. If there's any questions you have, please ask. And I'll see you in my next video. If you don't mind, please consider liking and subscribing. And I would appreciate that. And in the meantime, be happy. Be healthy, be blessed, but most of all, be positively you, because there's no one else quite like you, and that makes me so incredibly happy. You guys rock. Love you.